Now we'll move on to look at the muscles of the hand. We'll begin by looking at the extrinsic muscles, the long muscles of the hand which lie in the forearm. Then we'll move on to look at the intrinsic muscles, the short muscles that lie in the hand. Starting with the extrinsic muscles then, we'll look first at the flexors of the fingers, then at the extensors of the fingers, and lastly we'll look at the four long muscles of the thumb. Flexion of the fingers is produced by two long muscles, flexor digitorum profundus and flexor digitorum superficialis. Here's the deep finger flexor, flexor digitorum profundus. It arises from the anterior and medial surface of the ulna and from the interosseous membrane. Here are its four tendons, entering the carpal tunnel. We'll follow them in a minute. This adjoining muscle we'll see later on. It's flexor pollicis longus, the long thumb flexor. Now let's add the superficial finger flexor, flexor digitorum superficialis, to the picture. Here it is. It lies right on top of the profundus. It has two heads of origin, a radial head and a humero-ulnar head. The humero-ulnar head arises as part of the common flexor tendon from the medial epicondyle of the humerus and also from the adjoining ulna. Its radial head arises from this long oblique line on the radius. Between the two heads, there's a gap which the median nerve and the ulnar artery both pass through. The four separate tendons of flexor digitorum superficialis are bundled together as they enter the carpal tunnel. Before we follow the superficialis and profundus tendons into the hand, we'll bring the forearm to the upright position. As the flexor tendons pass through the carpal tunnel, they're all enfolded within this common synovial sheath, which extends into the palm of the hand. Just as the flexor tendons emerge from the carpal tunnel, the four profundus tendons give rise to these four intrinsic muscles, the lumbricals. We'll be looking at these later. For now, we'll remove them to simplify the picture. Just before reaching the MP joint, the superficialis and profundus tendons of each finger enter the flexor tendon sheath together. To follow them, we'll remove the sheath. Over the proximal phalanx, the superficialis tendon splits into two halves, which pass around the profundus tendon. We'll remove the profundus tendon for a moment. The two halves of the superficialis tendon reunite, and as they do so, they insert here, on the middle phalanx. The profundus tendon, here it is back in place, emerges between the two halves of superficialis and continues distally to insert here, on the base of the distal phalanx. The action of flexor digitorum superficialis is to flex the proximal IP joint and the MP joint. The action of flexor digitorum profundus is to flex both the IP joints and the MP joint. Now let's look at the muscles that extend the fingers. There are three, a large one that extends all four fingers and two small ones for the index and little fingers. The large one is extensor digitorum, sometimes called extensor digitorum communis. It arises from the common extensor tendon and thereby from the lateral epicondyle. As it passes distally, it divides into four slips, which pass together under the extensor retinaculum. We'll follow them beyond there in a minute. The extensor muscle to the little finger, extensor digiti minimi, arises from the ulnar side of extensor digitorum and passes under the retinaculum by itself. The extensor muscle to the index finger, extensor indicis, lies deep to extensor digitorum. It arises from the ulna and the interosseous membrane. Its tendon passes under the retinaculum along with extensor digitorum. Emerging from beneath the extensor retinaculum, the extensor tendons fan out. As they approach the MP joints, they branch and rejoin in an irregular fashion. Extensor indicis and extensor digiti minimi join the respective extensor digitorum tendons as they reach the MP joint. Here at the MP joint, each extensor tendon gives rise to the extensor hood, then divides into three parts, as we saw when we looked at the extensor mechanism a little while back. The extensor muscles produce extension at all three joints of the finger. Their main effect is at the MP joint. As we'll see later, the interosseous muscles and the lumbricals also have major roles in extending the interphalangeal joints. Now let's move on to look at the long muscles of the thumb. The thumb has a long flexor, a long abductor, and two extensors, a long one and a short one. The long flexor, flexor pollicis longus, lies deep in the forearm. We'll remove flexor digitorum superficialis to see it. Here's flexor pollicis longus, lying alongside flexor digitorum profundus. It arises from the anterior surface of the radius and from the interosseous membrane. Its tendon passes through the carpal tunnel with the finger flexors. Here's the tendon of flexor pollicis longus emerging. It enters the fibrous flexor sheath of the thumb and inserts on the base of the distal phalanx. Flexor pollicis longus flexes both the MP joint and the IP joint of the thumb. The other three long thumb muscles lie on the extensor aspect of the forearm. They lie deep to extensor digitorum, which we'll remove. This is the long abductor, abductor pollicis longus, and these are the extensors, extensor pollicis brevis and longus. The abductor arises from the radius here and also from the interosseous membrane. The two extensors arise a little more distally, the short one here, the long one here. Now we'll put extensor digitorum back in the picture. Here it is. The three thumb muscles emerge obliquely from the back of the thumb and part of the back of the index. The deep branch of the radial nerve, also known as the posterior interosseous nerve, is a motor nerve. It passes through the supinator and emerges here, deep to extensor digitorum. It breaks up into several branches. Between them, these supply extensor carpi ulnaris, extensor digitorum and the other two finger extensors, and these three long thumb muscles, abductor pollicis longus and extensor pollicis brevis and longus. Now let's look at the median nerve. Let's go back to the elbow where we saw it in the last section. Here's the median nerve, next to the brachial artery. To see where it's going, we'll retract flexor carpi radialis. The median nerve first dives between the two heads of pronator teres. It then immediately passes between the two heads of flexor digitorum superficialis. The median nerve, here it is, passes down the forearm between flexor digitorum superficialis and profundus. It emerges at the wrist to the radial side of the superficialis tendons. It's crossed by the tendons of palmaris longus and flexor carpi radialis. The median nerve passes through the carpal tunnel to reach the hand. It lies just beneath the palmar aponeurosis, which has been removed here. The median nerve gives off this small motor branch to the thenar muscles and then gives off these three common digital nerves. The common digital nerves break up into palmar digital nerves, two each for the thumb, index, and middle fingers, and usually one for the radial side of the ring finger. The medial nerve typically provides sensation to the medial half of the palm, the flexor aspect of the thumb, the index and middle fingers, and the radial side of the ring finger. Of the extrinsic hand muscles, the median nerve supplies flexor digitorum superficialis, flexor pollicis longus, and the radial half of flexor digitorum profundus. Of the intrinsic hand muscles, it supplies only the three thenar muscles and the radial two lumbricals. Lastly, let's look at the ulnar nerve. As you'll recall from the last section, the ulnar nerve enters the forearm by passing round the medial epicondyle and between the two heads of flexor carpi ulnaris. Here's the ulnar nerve. It runs down the forearm between flexor carpi ulnaris and flexor digitorum superficialis, with profundus deep to it. Here it gives off a dorsal sensory branch, which goes to the back of the hand. At the wrist, it runs along the radial side of flexor carpi ulnaris. Along with the ulnar artery, it passes through the side tunnel in the edge of the flexor retinaculum. Here it is emerging from the tunnel. As before, the palmar aponeurosis has been removed. The ulnar nerve divides into a superficial branch and a deep branch. The superficial branch divides into palmar digital nerves for the little finger and typically the ulnar side of the ring finger. The deep branch passes between the hypothenar muscles. To follow it, we'll remove the flexor tendons. The deep branch of the ulnar nerve runs across the palm in front of the interossei. It passes in between the two heads of adductor pollicis. We'll remove the transverse head to reach the most radial of the interossei. The ulnar nerve typically provides sensation to the ulnar half of the back and the front of the hand, and to the little finger and the ulnar half of the ring finger. Of the extrinsic hand muscles, the ulnar nerve supplies only the ulnar half of the flexor digitorum profundus. Of the intrinsic hand muscles, it supplies the hypothenar muscles, all the interossei, adductor pollicis, and the ulnar two lumbricals. Before we move on to look at the skin of the hand, let's briefly review what we've seen of the vessels and nerves. Here's the cephalic vein, the basilic vein, and the antecubital vein. Here's the radial artery in the forearm and at the wrist. The ulnar artery in the forearm and at the wrist. The superficial palmar arch, common digital arteries and digital arteries, and the deep palmar arch. Here's the radial nerve with its deep branch and its superficial branch. Here's the median nerve in the forearm and at the wrist, with its motor branch, the common digital nerves, and digital nerves. Here's the ulnar nerve in the forearm. Here's its dorsal sensory branch. Here's the ulnar nerve at the wrist with its superficial branch and its deep branch. Here's the distribution of the radial nerve, the median nerve, and the ulnar nerve.